We are obviously doing this remotely due to social distancing guidelines. I'm super excited to be joined by Dr. Shivani Patel and Dr. Robin Horsager, who are high-risk pregnancy experts at UT Southwestern. We're going to be dealing with COVID-19 and pregnancy. So welcome, Dr. Patel and Dr. Horsager.
Thank you.
Hello.
Glad you both could join us today. I know there's been a lot of talk. I have several friends who are pregnant right now, and they're worried about COVID-19, just like everybody else is. But given that they're pregnant, they have other types of concerns. I mean, what are some things that women who are pregnant right now should consider? We will start with you, Dr. Horsager.
I think typically the questions we've had from women are coming down into two categories. One is, how is the pandemic going to affect my pregnancy experience? Mm-hmm. Versus how is a possible COVID infection going to impact my pregnancy itself, my health, the health of the baby? So two different kind of groups of questions we're seeing.
Mm-hmm. Do you want to add anything, Dr. Patel?
Sure. So it would be Dr. Horsager. Those are exactly the questions that we're facing. And I think patients, need to know that I think at both UT Southwestern and in OB offices across the country, and providers are trying to make an effort to apply these same social distancing messages that we do both at home and out in public in their doctor's office and in the hospital as best as we can.
Mm-hmm. Okay. That's a good way to get us started. So, as a lot of hospitals have put in kind of guidelines, restrictions for the number of visitors that can be there. I mean, if a woman is coming in, what are some considerations she should take when she's planning all of the pre-delivery appointments?
So that's a really good question. I will say, I think the clinic piece is a little bit separate than the hospital piece. What we have instituted at UT Southwestern is sort of a bit of a modified prenatal schedule in that we are doing some of the visits virtually, meaning we get on the camera on the computer with the patient and we do those visits through our secure EMR system, versus other visits happen in person. And the way we've sort of made that differentiation is trying to keep the patient at home if it's not a visit that's going to involve an ultrasound or a lab test or something like that we can't actually do from home. And while still maintaining the full course of prenatal care visits, the still, complement of 10 visits, what is routinely normal for the normal patient. And then those women that have high-risk conditions, obviously their care is tailored differently, and they may not be able to have as many virtual visits and might actually see themselves coming to the office just as frequently as they were when there was no pandemic.
So women, when they do come to the office, are they required to wear masks? Do they have face? Is it typical as going anywhere else?
Yes. So I think every institution is a little bit different in these regards, but at UT Southwestern, all patients and visitors are screened at the door. They get screening questions regarding their symptoms. They get a check of their temperature to see if they do have a fever. And then everyone in Dallas County currently is wearing a mask at all times. So they are asked to wear a mask when they come to our building. And if they don't have one, then we give them a mask.
Okay, good to know. So Dr. Horsager, one of the questions that came up a little while ago, was this idea that, obviously there are certain symptoms that people should go to the hospital for. Do they differ for individuals that are pregnant? Are there certain things that women who are carrying a child really need to call you about?
I think in general, we'd like to hear about patients who are concerned about any symptoms first. And we can help with the triage process then. I think one of the questions would be, is it something that we can handle in the office and not have people have to go to the hospital, where typically the EDs can be busy. You may be exposed to more people with other kinds of symptoms. So I think call your provider first. Find out what the local practices are. If you do have to go to the hospital, your provider will let you know, are you going to go to the ED? If so, are there special things? If you're having respiratory symptoms, is there a special entrance you need to go to? Do you need to wait in your car until somebody comes out to meet you? Are you supposed to go straight to labor and delivery? There are a lot of different kind of issues that we're addressing. So it depends on, I think, what your symptoms are and what your local institutions are doing with patient triage.
Okay. Okay. Good to know. So we're starting to get our viewer questions in. I knew this would be a hot topic. Here's our first question. It's from Mindy. She says, I've been reading that diabetes puts people at risk for more severe COVID symptoms. Are the same risks associated with gestational diabetes?
So I think one of the fortunate things that we are seeing, and now that we've had several weeks of COVID infections in the community, is that unlike influenza infections, we're not seeing higher risk to pregnant women. So first of all, I think that is one piece of good news that we have. I would not expect gestational diabetes to place a woman at a higher risk for a COVID-19 infection. I would consider this things like hypertension and cardiovascular risk, or people who have further immunocompromised systems. Women who are on certain medications, who have had transplants, have to be at higher risk, but not gestational diabetes.
Okay, good to know. We've got a question here from Daniel. I think this is for you, Dr. Patel, because you talked a little bit about kind of what it looks like to come into the hospital. He's wondering if women who are in labor are tested for COVID when they're admitted to the hospital.
Yes. So at UT Southwestern, we have implemented universal testing for all patients that are admitted for a procedure on our unit, which would mean a delivery. And so, yes, if you are receiving prenatal care with us and we know it's going to be scheduled delivery, meaning a scheduled induction or scheduled C-section, we're actually trying to test those patients about 48 hours ahead of time. So we have that information when they arrive to the hospital or prior to arrival. For patients that come in labor, and that's, part of being in obstetrics is things are, going to occur when they're not scheduled. And those patients will get tested on admission to labor and delivery.
Okay. Thanks for the question, Daniel. We've got another question here from Brooke, and it's a little bit more general, but what does the L&D process look like for women that are positive for COVID-19 at the time of delivery? Are they allowed to stay with their child? I know we do a lot of in-room, like at Clements and at other hospitals in the area. How does that work?
Women who we know are infected, are kind of recently or actively infected with the COVID-19 virus, are initially put in a special room. They are called negative pressure rooms, and they are designed to not circulate viral material into the general labor and delivery unit. So you're going to go into a special room. You probably wouldn't even recognize, though, that it is a different room than any other room. So don't worry about that. Your healthcare workers that are in your room are going to be wearing more extensive protective gear than what you would have normally seen. They may have full face masks on. They'll have special or full face shields with special masks. You may or may not be able to have a visitor depending on what your local institution's, local hospital's policy is. At Clements, we do allow women who are infected to have someone stay with them during the course of labor. We think that's the compassionate and right thing to do, but that's not a uniform policy across all institutions. And then after the baby is born, there are some tough questions that have to be answered by the parents. And the American Academy of Pediatrics currently suggests that newborns should be isolated from an infected mom for, up to 14 days. And that means that baby would go somewhere else and that you aren't going to get to see the baby. But again, that's a decision that the woman and her partner will have to make on a case-by-case basis.
Okay. It looks like you've got another related question about, do we know anything about how COVID-19 may impact breastfeeding? That's still, I feel like I've seen studies that they're still looking into that.
Yeah, so we don't really know exactly how that impacts breastfeeding. There is very limited data, obviously, on what we know about COVID and pregnancy at this point, much less in the postpartum period or the lactation period. We do know that women are still encouraged to provide breast milk to their child. And so whether they choose to directly breastfeed and wear a mask or wear a breastfeeding cover or something like that to, if they're COVID positive, to prevent droplet spread, then that's one option. Others can pump and have someone else, if they're choosing the separation route, to feed their baby breast milk through a bottle. So we are still encouraging women to breastfeed because breast milk still has important antibodies, and some of those might be COVID antibodies that we can't detect yet or aren't good at detecting yet, and that might actually provide some protection for their infant.
Okay, good to know. I know I see some other questions coming in here. There are a couple about whether we've had any COVID positive women in labor. We can't answer that question due to privacy restrictions. We do maintain, however, numbers of people that are in the hospital currently on our COVID website at utsouthwestern.edu. So you have questions about kind of our rates of patients, please visit there. I know another thing that's been in the news, I think it sounds like women who are pregnant just don't really know who they should go to if they have questions. You know, should they contact, you know, should they go to their OBE? Should they go to the ER? Should they contact the clinic? I mean, what's their first line of defense if they have any concerns?
I think if they've got a specific concern about their medical condition, they need to contact their provider. And they may need to realize that due to differences in how clinics are being staffed, it may be an on-call physician. So it may not be their own provider, but the on-call doctor. But I would expect that they would be able to, you know, access their records and address individual personal concerns. On a bigger note, there are other sites. ACOG's got some excellent resources for pregnant women. The CDC's got a whole section on COVID and pregnancy with respect to patients that gets updated. I think one of the things we would suggest is, you know, making sure if you're online, making sure that you know what the source is of the information you're getting. You don't want to get yourself kind of into a situation where you're receiving advice that perhaps is even contrary to good medical care and recommendations.
Okay, good to know. We see another question in here. This one is from Felicity. May take me a second to read. It's a little long, but it's a good question. It seems from certain reports that hypercoagulability is an issue in some clinical courses of COVID-19. Is this a concern from the standpoint of pregnancy loss or harmful clots for the mother, since pregnancy already predisposes a woman to clotting issues?
That's a really good question. And yes, there are reports coming out of other areas of the country that have had higher prevalence of COVID, that these patients do seem to have are more likely to get blood clots. We don't totally understand that currently and what the reason behind that is. Pregnancy is a hypercoagulable state, but we don't know how COVID interplays with that existing hypercoagulated state. So while yes, that is a concern, it's definitely something that we as obstetricians and maternal fetal medicine physicians know about, and definitely is in the back of our heads when we take care of a COVID patient. But as far as how that interplays with pregnancy exactly, we don't have that information at this time.
Okay, there is a second part to that question from Felicity. I'm glad you joined us. Is there a downside to taking aspirin or a stronger blood thinner?
Yeah, so unfortunately, just taking one aspirin a day or taking a blood thinner is not necessarily going to be the answer to this. It's not even necessarily that we universally place COVID positive non-pregnant patients on aspirin or a blood thinner. So just using it in pregnant patients just because of the idea that it's a hypercoagulable state at baseline is not something that we would recommend at this time. It's definitely something you have to talk to your physician about, because there definitely are risks to being on a blood thinner or on aspirin in pregnancy.
Okay. Good question, Felicity. We're glad you could join us. Here's a different question from Jacqueline. And she's wondering if you can talk about newborns and COVID-19. They're wondering if they could have a night nurse And how are newborns impacted if they get COVID? Is that something that's well known at this point?
I don't know that there's a whole lot of information about that. There have been a few case reports of newborns being infected, but I'm not sure that we really have very much information about what COVID infections look like in them.
Mm-hmm. So what about the night nurse? Does that sound, how would we respond to, they would like to have a night nurse? Is that something that's a good option?
I think, a night nurse or any other help that's coming into your house, what you want to do is make sure that you are screening them similarly to how you're being screened when you walk in to your doctor's office or to a hospital or a lab drawing station. You may want to take a temperature when they come in. You may want to find out have what kind of symptoms, if any, that they're having, who they've been exposed to. So I think, from the standpoint of people frequently need help with newborn care. It's just a matter of, I think, being a little careful about it.
Okay, good question. Thanks for joining us, Jacqueline. We're glad you could come in today. I know we've got lots of questions. We are we're more than halfway done with our chat. So if you have those questions, please submit them now. I'm curious for both of you, Dr. Patel and Dr. Horsager, what kind of concerns are you seeing with patients in the clinic that, are widespread that could help our audience?
I think the biggest question that patients really have is, one, how are they differentiating these potential symptoms of COVID that they're having with what might be normal pregnancy symptoms? And I think, we have probably read everywhere that shortness of breath or feeling winded is one of the symptoms of COVID. But there are definitely patients who will say, well, I'm 36 weeks pregnant and I feel short of breath and I feel winded when I go up a flight of stairs. And I think that is definitely a very good question, a question that we get pretty often in clinic. What I usually tell patients is that you sort of know what your baseline is. You know how you have felt throughout this pregnancy and how that shortness of breath has changed over the course of weeks. If there's a sudden or acute change in those symptoms, or you have other things like a cough, which is not normal in pregnancy, or a fever, then that's one way to differentiate what is normal shortness of breath in pregnancy compared to what might be COVID or coronavirus infection.
Okay. And we touched on this lightly, but it gets to a couple of the other questions, but should pregnant women be concerned about the screenings, particularly the ones that put them in a hospital setting?
No, I think with respect to all pregnancy care, what we're trying to do is balance the risk of going out into kind of your community, running into people along the way, be it in your clinic building, in your clinic, the people who check you in, with what's the value of that test going to be to the pregnancy. And I think the doctor's offices have done a pretty good job of saying these visits are important. It's still important for you to be seen at 36 weeks so we can test you for group B strep carriage. It's still important probably for you to have your ultrasound at 20 weeks so we can look at the development of the fetus. It's still important if Down syndrome screening is important to you. It's important that you have it. So I think the offices have done a good job of doing that. Certainly, if there is something that you aren't interested in doing, if you're not interested in Down syndrome screening, then there's no need to go out for an extra blood draw or for an extra ultrasound. So I'd say talk to your physician about what kind of testing and what sort of what you're going to do with the results. And on a case-by-case basis, we can make adjustments to your prenatal visit schedule.
Good questions. We've got another question here. This is related to something actually that I saw in the New York Times last week. And the question is, some friends of mine are considering home births because of COVID-19 in the hospitals. What are your thoughts on this?
That's a really good question. I can understand that people are thinking about having home births and not trying to enter the hospital and potentially become exposed to coronavirus in the hospital. But I will say that home births carry a risk, And that is something that everyone needs to be aware of, that it's not just, the chances of getting coronavirus when you're in the hospital is far smaller than some of the other things that can happen after having a baby, like a postpartum hemorrhage. And, even just the course of the labor, monitoring the baby, making sure the baby's okay during labor. So those are some of the things that happen more frequently in labor and are probably more worrisome than the chance of catching coronavirus from being in the hospital.
I think the other aspect to home births that people might find attractive is this issue about limited visitation now in the hospital. And I think what we're telling patients is, think about it being a time for you and your partner to really have some quiet time, bonding time with the baby. You don't have to worry about looking picture perfect for visitors that typically you would have had coming in, every couple hours in the hospital. Take the time to, ask your nurses questions and get your problems and educational material taken care of. And there'll be time for visitors later, but don't change your delivery plan because of a visitation policy.
Okay. We've got time for a couple more questions. Here's one that came in, another one from Mindy. What's the best way, and this could apply for selecting an OB-GYN as well if somebody doesn't already have one, but what's the best way to go about selecting a pediatrician with social distancing in place?
That's a good question. So I know a lot of families tend to try to meet their pediatrician ahead of time before they actually choose the pediatrician they're going to have to take care of their child. And I think that same thing can still be done. I think calling these pediatricians' offices, a lot of them are still open. They're doing routine pediatric visits. Vaccination schedules have not changed. That's still very important. So I think calling these pediatric offices, asking them those questions, getting to know their providers, what does their office schedule look like in the time of COVID and this pandemic right now? Are you seeing patients all the time, every day? Do you have a limited schedule? What happens if we think there's an exposure? How would your clinic handle it? So I think these pediatrician offices are definitely not closed. They're still open, and just reaching out to them is, I think, still important.
Okay, good to know. We have one more question. This one's from Kathy. Is there any suggestion that COVID could cause birth defects like Zika does? Is it too soon to tell?
It is probably too soon to tell. There's not any reports, and it's too early to say if it has the same impact that Zika potentially has.
Okay. All right. They're flooding in now. So we're going to take this question from Tim. What is the risk of a healthcare worker bringing COVID-19 back to his pregnant wife as long as he's wearing a face mask, a respirator, and taking all the necessary precautions?
I think we would say that the risk is still very low. What we see is sometimes the healthcare workers, when they're going home, they like to have arrangements set up so they can change clothes, they can shower, before really becoming part of the family again. Certainly, I think if that worker were to develop any symptoms or have an exposure in the hospital or in the clinic that didn't involve proper PPE, then that would be something else to talk about with both your occupational health team at your work and your partner's obstetrician.
Okay. I think that's all the time we have. Ladies, Dr. Patel, Dr. Horsacker, do either of you have any final thoughts you want to share?
I would just like to say that I think we recognize that pregnancy is a time of uncertainty, even at its baseline. You don't know what's going to happen during pregnancy. You don't know what the delivery is going to be like. You don't know what your child's going to be like. And I think all of us understand that there is an added layer of anxiety produced by COVID. And we would just encourage people to recognize that they may be more anxious, talk to their providers about it if they are, because there may be some additional help that we can provide.
Okay. Dr. Patel, do you want to add anything to that?
I think just know that we're available at UT Southwestern and in our OB and MFM clinic. And if patients have questions, that to please reach out to us.
Okay, sounds great. Well, I want to thank everybody for tuning in today. This chat will be available here on Facebook, and it'll also be posted on our YouTube channel later this afternoon. So if you have friends and loved ones that aren't on Facebook, please feel free to share that link with them. And you can also check out our COVID-19 website at utsouthwestern.edu/coronavirus for additional information about what we're doing at UT Southwestern. I want to wrap up by thanking you, Dr. Patel and Dr. Horsager. Thank you both for joining us today and for sharing your time and expertise.
Thank you.
Thanks.
All right, everybody, have a great day.